does a facelift work after patients undergo cosmetic procedures? I'm Dr. Yuni Favarin.
I am Dr. Eduardo Favarin.
So just so everyone understands what I'm talking about, this work is a work that has not yet been published. So he's super young. It should be included in the publication in Bev. This is his manuscript that was accepted. And why did I find it so interesting to bring him in to talk? Because it explains with an immense wealth of detail everything that we see in surgeries and everything that I always explain to you. In this work, he did a retrospective evaluation of his cases from the past year. And he showed what happens during surgery and how we need to prepare the patient. When the patient has already had, for example, CoolSculpting, Morpheus, or in the United States, they often do Kybella, which is an enzyme used to cause fat necrosis to treat localized fat. Endolaser, which is the lipolaser that's very trendy in Brazil, especially among non-physicians. PDO threads, and OneTera, which are advanced technologies that effectively use heat, precisely releasing thermal energy at a significant depth. So today I'm going to specifically talk about how these particular treatments profoundly impact our patients' overall results. And the first detail I want to mention is that this changes the patient's outcomes. And that's what we see, right, honey?
Yes, in practice we notice that the article mentions changes in anatomy.
And it says at the end of the discussion that we need to prepare patients for results that may not be ideal. It's possible to perform the surgery, but the patient needs to know that the result might not be ideal, and they must be psychologically prepared for the possibility of complications. And these complications are directly related to the aggressiveness of the procedures, the amount of energy used, and the type of procedure performed. Here we see a lot of procedures being done by non-doctors, right, honey?
Yes, it's very common. And when there are significant complications or suboptimal results, they inevitably end up coming to us, the medical professionals, the doctors, for further evaluation and treatment. And when we operate on these patients, then we find there is
the most diverse,
a single array
of all the different changes you can possibly imagine.
Sometimes with the suspension threads, we are working in a deep plane, in the deep degloving plane, passing through the pre-masseteric space, the encomedical masseteric area, and we find the suspension thread deep inside, very close to the nerves, the important structures of the face. In other words, sometimes the people who place these threads have no sense of depth or anatomical plane, and that really worries us. Sometimes, right, love? We can't remove these threads. We go in, cut it, and leave the thread there.
I would say that we don't even try to remove the threads because most of them are barbed threads, threads with little hooks, and if we try to take them out, they end up damaging the surrounding tissues. So what we do is try to release as much of the tissue as possible so we can create our own traction planes. And this is one of the details that the article also shows, which is exactly what we see. We need to be more careful during dissections. Dissections are more difficult. For example, in the case of the neck, there is a stripping, a trauma to the superficial fat, which is the fat that lies above the platysma. The planes are more adhered, and this fat becomes irregular, with retractions, which creates irregularities in the flap postoperatively. And usually in these cases, we end up not being able to detach the skin as extensively as we would like. We have to work in the deep plane, and in the deep plane, we need to release the structures as much as possible to create the effect of the angles. So this is a detail that needs to be very clear to everyone. Performing secondary surgery is never the same as performing a primary surgery. Every time we are going to reoperate on a neck, a face, or an eyelid, or when we are going to work on an area where the patient has had repeated cosmetic procedures throughout their life, we need to be prepared for that. And one of the ways we can prepare ourselves and also prepare the patient for what might happen afterwards is by performing a dermatological ultrasound. Here at the clinic, it's pretty much routine. We ask 100% of patients who have a history of facial injectables or previous facial procedures, such as those neck surgeries people get done in offices, to undergo this. Chin liposuction, for example. In short, if anything has been altered or the anatomy has changed, we request an exam to have a map, a guide of what we're going to encounter during the procedure. And this article serves as a warning not only for us doctors, but also for patients that every time you choose to undergo an aesthetic procedure and then later decide to have surgery, you need to understand that you are not the same as a patient who has never had any procedures done. This is especially true for the neck area because the structures there are delicate and there are many important structures passing through. In fact, the article even mentions that the surgeon needs to prepare the patient, as it is more common for them to experience changes in facial expressions after surgery because all the structures are stuck together, including the nerves, right?
Yes, these treatments induce the formation of fibrosis, which are internal scars, and when we perform surgery on the face, the neck, or the upper third of the face, we do so with knowledge of the anatomical planes. We always make a comparison that the face is like an onion. It has layers, just different layers, and when this sense of the planes between one layer and another is lost, things get complicated, surgery becomes more difficult, and there's more bleeding.
And the chance of complications is higher. There's no doubt about that. And another statistic that I found very interesting in the study, and it's even lower than ours, is that from 2021 to 2024, which was when the data was collected, the percentage of patients who had previously undergone facial procedures rose from 24% to 68%. Here at the clinic, I would say it's 85%. I actually did some statistics. I was curious to check my records, and 85% of my patients have had some procedure done on their face. So this is the new reality we face in facial surgery, and we're preparing ourselves technically to be able to offer these patients the highest level of safety and predictability. But it's very important to understand that this doesn't depend solely on our technique. It also depends on the after effects left by previous treatments. Today, before I started seeing patients, I had a meeting with Dr. Gervani. Dr. Gervani is the specialist in hyperbaric medicine who assists our patients who are going to undergo hyperbaric chamber treatment. And what exactly is the purpose of the hyperbaric chamber? Explain to everyone why we recommend this so much for post-operative patients who use the chamber.
A hyperbaric chamber is an enclosure where there is a 100% concentration of oxygen and the patient stays in this environment. Usually each session lasts about an hour. The 100% oxygen leads to better oxygenation of the tissues, preventing fibrosis, necrosis, and skin issues, improving healing, speeding up the patient's recovery, reducing edema, which is swelling, among many other advantages, right? I think we're talking about first world medicine here, right? Something that's done in the United States or at Albert Einstein or at Syrio-Libanese, the best of the best, right? The best in Brazil too.
Yeah, but that's the goal. We have to offer what we believe actually works, right? And what will give the best results for the patients. So I recommend hyperbaric chamber treatment for 100% of my facelift patients, especially for those with a history of injectables, those who have had previous procedures, for secondary surgeries, and for patients who are going to have fat grafting. So it works, and it works really well. Today, I had a patient who asked me, okay, doctor, but what if I don't do it? Well, if you don't do it, your result won't change after a month. None of these post-op procedures we recommend, whether it's drainage, taping, or hyperbaric chamber, change the final result, but they do enhance the outcome. The result doesn't make the surgery safer. It makes the post-operative period smoother, more predictable, and speeds up the patient's recovery. That's why we recommend them. And I always tell the patient, this is a procedure you won't do every year. This isn't like Botox. This is something you'll do once in your life, and it will take a decade before you might need or want to repeat the procedure. So the moment for us to intervene and do everything necessary to achieve the best possible result is when we perform the surgery. It's when you're in the immediate post-operative period. So you can be sure of that, right, love? Everything that exists in the world that works and that we believe in, we recommend to our patients here at the clinic. I think this applies to all surgeries, right?
Yes, that's the intention, right? To offer patients the best suture available, right? In the past, we used the nylon thread to do the plication in abdominoplasty. Today, we use the best thread there is, a barbed suture, right? An absorbable suture. It's the details that make the difference, right? They're not major changes. And in facial surgery, we believe in that too, right? From the smallest details, I think the instruments we use, the materials, the team, it's a combination, right, that leads to more visible, better results. I like to compare a surgery to a flight plan where you take off, leave the ground, have a smooth flight without major turbulence, and then land smoothly. ending with the patient waking up and the surgery completed.
So that was today's message. We really need to be very discerning, right? When we perform surgeries on patients who have had previous procedures or surgeries, there is indeed a higher risk of complications. And yes, we need to take different precautions compared to patients who have never had any procedures on their face. And of course, each case will be evaluated individually, right? Everyone, thank you so much for participating. Have an excellent week and see you next Monday. Bye.